Yep. Hi, this is Greg. So welcome. This is day 2 of the short broadcast that I'm doing, and there will be an article on the website to accompany this. So this is Greg's Minute in the Clouds, and today I'm talking about ADHD. So welcome to another episode. ADHD is a topic which affects many people, including myself. Adult ADHD, and it's what is adult ADHD? Well, it's a lot more than just being a little forgetful or disorganized. It's a legitimate disorder affecting the brain, and people with ADHD are often mistaken or misunderstood. People think that we're eccentric or overly spontaneous. Sometimes they might think of us trouble as they might think we're troublemakers, loud, obnoxious, constantly interrupting others, and we may also be seen as daydreamers, not paying attention, lazy, and a lot of other derogatory labels. It used to be that there was 2 separate diagnoses. There was ADD and ADHD, and ADD stood for attention deficit disorder, and ADHD stood for attention deficit hyperactivity disorder. One moment, I suffer with dry mouth. So they rolled it into one diagnosis, which I wish they didn't. I was never really hyperactive. I had the inattentive type, and at school he had me pegged as a troublemaker. Said I'd never amount to anything, never do anything. But we'll get into that stuff in another thing. So oftenly mistaken for those things, and it can manifest itself in a number of ways. Each person's different. You could have difficulty focusing, problems organizing, staying organized. Point in case, I've been trying to post an article for months and months, and I start an article, never finish it, and start another 100, which I talked about yesterday. So problems getting organized, prioritizing tasks. Sometimes you can be restless. That's the hyperactivity part. Problems with managing your time, and sometimes people can get mood swings or might be forward others having a temper. So you'll have to bear with me if I lose my train of thought, because I have a traumatic brain injury as well. So it affects people different. So how can you determine if you might have ADHD? You'd need a formal diagnosis from a medical professional, and they'll assess a bunch of different criteria. If you think that you might be noticing some symptoms, or someone that you trust has noticed, I mean, after all, when you've got ADD, you can't always remember how it's affecting your body, and it could have really affected your daily life. It's worthwhile seeking some advice for that. Typically, it's diagnosed with a comprehensive assessment. A good person to get an assessment from would be an ADHD clinic, or psychiatrist, psychologist, and actually children's psychologists and children's psychiatrists are very good at assessing and treating adult ADHD. I know that I said children's psychologists, pediatrics, but they treat adults as well, and they're usually very up to date on what's going on in the world of ADHD and different treatments. So some of the criteria that they'll use if they do a diagnosis, or an assessment, I should say, they'll look at inattention. If you have inattention, do you have trouble staying focused on different tasks I've mentioned, maybe making careless mistakes, overlooking the details at work or at school, trouble organizing your tasks and activities and prioritizing them. Following instructions can sometimes be difficult, as well as finishing tasks. Avoiding tasks that require a lot of mental effort is sometimes a thing. And just as a sidebar, I wish that they didn't call it deficit, because it's not a deficit of attention at all. If anything, it's a surplus, an overabundance of attention. The problem is our mind's going off a million miles an hour all over the place, popcorn style. And we're trying to work on something, and we have a thought, and then we've got these 65 other thoughts in our head, and we're jumping all over the place. But then, maybe we've got a job interview and we turn up late, we don't get the job, but on the way home we see a notice in a window, and then the next thing we make an invention and a patent, that different things like that. So the other thing that could be hyperactive, you can be hyperactive. that part of it, restless, being driven by a motor on the go all the time. You can't sit down, need to pace backwards and forwards. Maybe some people you might observe, or other people might know, you're interrupting, impulse control, acting before you're thinking, making a hasty decision, can't wait your turn in conversations or situations, get impatient and stuff like that. Children have a hard time delaying gratification when they've got it. So how do you treat adult ADHD? Well, there isn't a one-size-fits-all treatment. There are medications such as stimulants and non-stimulant medications. There's a lot of different medicines now, and it doesn't mean just because you've got ADD that you would have to take a medication. And certain antidepressants can also be used and be quite effective. And then they use off-label things for treating as well. I've got a device, and I'll do a post on this. It's called a Fisher Wallace stimulator, and it kind of does electrical things, but that's a different day. So it's not just about medication. Cognitive behavioral therapy can be very good as well, and working with an ADHD coach can be quite good. Lifestyle changes can make a big difference. Exercising, a healthy diet, plenty of sleep, limit caffeine. Well, I disagree with that, limiting caffeine, because when you've got ADHD, you act differently to stimulants like Adderall, which is a very well-known ADHD medication. It's amphetamine sulfate. It's speed, legal speed. And if you've not got ADHD, that stuff would jack you up. I've been bouncing off the walls. And I take a really large dose because medicine doesn't work very well on me. And it just kind of clears things. It has the opposite effect. So caffeine as well can be used as that. And then certain supplements, omega-3 fish oils from a very good source. So fish oil is thought to be effective in treating that. And some people think zinc. There has been some studies that zinc. And again, I'm not a medical professional. This is not medical advice. Do not do anything based on what I've said without seeking advice. Some resources, and I'm going to do the article for this will be on the website gregscloud.com. Excuse me, and I will post the article. It'll either be later today or in the morning. But there's some resources. CHAD, which stands for Children and Adults with Attention Deficit Disorder, is a great place to start. And then there's apps you could use, Evernote, Headspace, things like that. But it's not all bad. It's ADHD can be seen as a real big advantage, especially in entrepreneurship, because our energy and creativity. So we're often very creative, innovative, and unique perspective. And I'm going to end here because I keep getting phone calls, and we will continue tomorrow. I'm sorry, fucking bastards! In the middle of my hello.